One can open the DVD and search the cases by a number or category. In this case, we'll choose cardiomyopathies, and we'll start with this case, number 53. Reviewing the short axis images, which are noted in the top row, it can be seen that the right ventricle is dilated and poorly functioning. The left ventricle appears to be functioning relatively more normally as one proceeds from the base to the apex. Note the marked akinesia of the right ventricle as well as its dilatation. In addition, there appears to be excessive trabeculation of the right ventricle as apparent on these four-chamber images. There does not appear to be any evidence of an atrial septal defect, which could also cause a right ventricular enlargement, and no anomalous pulmonary veins are seen. Delayed enhancement imaging is demonstrated with true-FIS single-shot images in this row, and scrolling through these images one can clearly see abnormal enhancement not only of the entire right ventricular free wall but of the right ventricular portion of the septum as well. This is confirmed on the high-resolution images, as can be seen in this static delayed hyperenhancement image. The diagnosis then: these are fat-suppressed, T1-weighted pre-fat suppression and post-fat suppression images that attempt to demonstrate fibrofatty infiltration, but are difficult to interpret as evident on these images. By clicking on the diagnosis, first we'll click at history, 40-year-old male with occasional syncope. One can click on the diagnosis, which confirms our suspected diagnosis of arrhythmogenic right ventricular cardiomyopathy or dysplasia, a form of cardiomyopathy characterized by a fibrofatty infiltration of the right ventricle associated with right ventricular dilatation and functional impairment. The discussion notes that it is a familial disorder that often presents with arrhythmias and can lead to sudden death. Historically, diagnosis has been based on the presence of fatty infiltration in the right ventricular free wall, but this is often difficult to determine with certainty, and newer imaging with delayed enhancement imaging has been reported to be abnormal in approximately two-thirds of cases, as is noted in this present case. References are attached to the diagnosis and can be accessed by clicking onto the links, which will then take the reader to the article abstract in the PubMed site.